Disease overview. Signs and symptoms. The characteristic features of BWS vary greatly from person to person, which can make clinical diagnosis based on physical exam findings and molecular diagnosis based on genetic testing challenging. The range of clinical features due to changes on chromosome 11p15.5 has been redefined as the Beckwith Wiedemann spectrum. Some infants with BWS are born prematurely, but still have an excessive birth weight, large for gestational age, abnormal enlargement of one side or structure of the body, lateralized overgrowth, may occur, resulting in asymmetric growth. Abdominal wall abnormalities can include an omphalocele, also known as exomphalos, in which part of an infant's intestines and other abdominal organs are outside of the body because of an opening in the belly button. Additionally, the internal organs of affected individuals can become abnormally enlarged. Organomegaly. Causes. Genetics is the study of genes, whereas epigenetics is the study of how those genes are turned on or off. Gene expression. BWS results from various abnormalities affecting the proper expression of genes that control growth within a specific region of chromosome 11p15.5. Affected populations. BWS affects males and females in equal numbers. It is estimated to occur in 1 in 10,340 individuals in the general population. Disorders with similar symptoms. Simpson-Galabi-Behrmel syndrome is an X-linked recessive genetic disorder due to mutations in the GPC3-ORG-PC4 genes. Simpson-Galabi-Behrmel syndrome is characterized by overgrowth before and after birth. Macrosomia, a particular facial appearance including widely spaced eyes. Hypertelorism, coarse facial features, large mouth. Macrostomia, large head. Macrocephaly, large tongue. Macroglossia, and mild to severe intellectual disability. Perlman syndrome is an extremely rare recessive genetic disorder due to variants in the DIS3L2 gene. Perlman syndrome is characterized by overgrowth before and after birth. Macrosomia, distinctive facial features, enlarged internal organs. Organomegaly, the presence of fragments, rests, of embryonic tissue in the kidney. Nephroblastomatosis, and a predisposition to developing Wilms tumor. Soto syndrome is a rare genetic disorder due to sporadic variants of the NSD1 gene. Characteristic facial differences may include a large head. Macrocephaly, that may appear elongated. Dolichocephalic, with a prominent forehead. Frontal bossing, widely spaced eyes. Ocular hypertelorism, downwardly slanting eyelid. Folds, palpebral fissures, a highly arched roof of the mouth. Palate, protrusion of the lower jaw. Prognathism, and/or a pointed chin. Diagnosis. Patients with BWS can be diagnosed both before and after birth, prenatally and postnatally, either by physical evaluation, clinical diagnosis, and/or genetic testing, molecular diagnosis. In some cases, certain procedures may be performed before birth, prenatally, to detect BWS. For example, ultrasound imaging may allow assessment of organ size and overall size of the developing fetus and potentially reveal other findings that may be suggestive of BWS. Treatment. The treatment of BWS is directed toward the specific symptoms that are apparent in each individual. Treatment may require the coordinated efforts of a team of specialists. In newborns with BWS, regular monitoring of blood glucose levels should be performed to ensure prompt detection and treatment of hypoglycemia in the immediate neonatal period. Treatment measures may include the administration of intravenous glucose, frequent feedings, certain medications, e.g., diazoxide, or octreotide, and/or surgical intervention in some cases. Thank you for watching. Please subscribe for more videos. Your like, comment, and share always motivate us.